think for a moment about how connected everything in our body really is. It might seem like seeing, hearing, even just breathing clearly feel like totally separate things, right?
You tend to think of them in isolation.
Exactly. But what if they're all, deeply interconnected? And what if that system has this surprisingly big impact on how we learn, how we feel?
That's a really great way to frame it. And it's absolutely true. To really get into that, we're going to draw on some fantastic insights today from Dr. Howie Knoff.
Ah, yes. Project Achieve Educational Solutions.
That's the one. His work is all about the biological foundations of how students develop, how they learn, and importantly, how different challenges can pop up.
Right. So our mission for this deep dive really is to explore just how vital vision, hearing, and even like basic respiratory health, how vital they are for learning, for socializing, and maybe even as clues if something bigger needs looking at.
And what's really interesting from Dr. Knopf's work is how these, seemingly common issues, the kid needing glasses and ear infection, can sometimes hint at more significant neurological connections.
Okay.
Understanding that can give us a much deeper insight into maybe the root causes of learning or behavioral issues that aren't immediately obvious.
Okay, so let's dive in. Starting with vision. It feels so fundamental, especially for young kids.
Oh, absolutely. Dr. Knopf's work highlights that something like 80% of early learning is visual.
80%. Wow. That really drives home the importance for parents, for educators, for everyone, really.
It really does. And that's why those school-based vision screenings are so critical as an early detection tool. Though it's worth remembering, they mostly happen in elementary school. They're just a snapshot.
Right, which means the follow-through is key, doesn't it? If the school flags something.
Exactly. The responsibility really falls to the parents then to schedule that proper comprehensive eye exam.
Yeah. Dr. Knopf stresses that a positive screening isn't like a diagnosis itself.
No, not at all.
It's more of a signal, a strong signal that you need a professional, an optometrist, or an ophthalmologist to take a closer look.
Precisely. And during those exams, they're looking for specific things.
Yeah.
Visual acuity issues.
Like?
Well, for the younger kids, say 3 to 5, vision worse than 20/40 is a concern.
Okay.
For older kids, 6+, it's more like 20/30.
And it's not just the overall number, right?
No. Even if each eye seems okay on its own, if there's a difference of 2 lines or more on the chart between the 2 eyes, that needs attention too.
Got it. And it's more than just how sharp the vision is, isn't it? There are other functional things.
Oh, definitely. Things like, can the child track a moving object smoothly? Can they hold their gaze? Recognizing shapes, letters, numbers at the right distance for their age. Hugely important in class.
Of course.
They also check for things like suppression, where one eye might be kind of slacking off, or poor depth perception, and color vision too, which interestingly is more common for boys to have issues with.
Yeah.
Genetic factors, mostly.
Right. And Dr. Knopf also points out things parents or teachers might just see, observable signs.
Yes, like if the eyes don't seem aligned or one eye wanders, that's a big one.
Yeah.
Also, pupil abnormalities, maybe different sizes, or reacting weirdly to light.
Okay.
And then there's persistent squinting or tilting the head, funny to see.
Glad to compensate.
Exactly. Or nystagmus, that's like involuntary eye movements. And even a droopy eyelid, kurtosis, if it's blocking their view. All things to watch out for.
Okay, now this is interesting. Dr. Knopf mentions a jump in myopia, nearsightedness, around ages 7 and 8.
Yeah, that's a key point. Around 10% of kids develop it then.
Why then specifically?
Well, he connects it to the increase in academic demands right around that age.
Makes sense.
And significantly, the print size in books often gets smaller then, too. More close work, smaller text.
Ah, right, because myopia means you see, up close, but distant things like the board get blurry.
Precisely. So that timing, with more intense near work in school, it just lines up.
And myopia isn't the only one. You mentioned refractive errors.
Right. There's also hyperopia, or farsightedness. Affects maybe 5 to 7% of elementary kids.
And that's difficulty with close work.
Yeah, that can cause eye strain, headaches, makes reading tough.
Okay.
Then there's astigmatism. That's more common, maybe 15% or so.
And that affects?
Vision can be blurry at all distances with astigmatism. And Dr. Knopf cites a study linking uncorrected astigmatism to a nearly 30% higher risk of reading below grade level.
Wow, 30%. That's significant.
It really is. And these uncorrected issues, they're not just, a small hassle.
No, I imagine not. What are the consequences?
Well, Dr. Knopf lists quite a few. Kids might start avoiding reading or close work entirely.
Understandable.
They can have trouble sustaining attention. They might develop those head tilts we mentioned. Reading comprehension can definitely suffer.
And physical stuff, too.
Absolutely. Chronic headaches, especially frontal ones, eye strain, general discomfort, maybe dry eyes, even dizziness sometimes. And over time, it can actually make myopia worse or lock in those weird head postures.
So it feeds into itself.
Sort of, yeah. And the academic impacts are broad. Reading, writing difficulties, attention issues, trouble copying from the board, even math errors from misreading numbers.
Which must affect how they feel about school, about themselves.
Totally. Leads to frustration, lower self-confidence, anxiety. Sometimes it gets misdiagnosed as just bad behavior.
Right.
It can lead to social withdrawal, maybe even depression in some cases.
Okay, but there's good news here, right? Early detection makes a difference.
Huge difference. Dr. Knopf points to research showing really positive results.
Yeah.
An average 17% improvement in reading fluency.
Wow.
A 20% increase in time on task in the classroom.
That's significant.
And get this, a 32% decrease in behavioral referrals just from fixing the vision issue.
That's incredible. It really highlights the impact.
It does. And doing screenings more often, especially around ages 7 and 8, seems to catch about 25% more problems than just screening once.
So more frequent checks could be really beneficial.
Seems that way.
Now, screenings aren't perfect, though, are they? Dr. Knopf mentions false positives and negatives.
Right, that's a crucial point. Sometimes a screening might suggest a problem that isn't really there, a false positive.
Okay.
Or, maybe more concerning, it misses a problem. Is there a false negative?
Why would that happen?
Could be a few things. Maybe the screening wasn't done quite right, or it was focused only on certain issues and missed something else, like astigmatism.
Uh-huh.
Or sometimes kids can kind of compensate during the test, maybe unintentionally, maybe not.
Right. So if a child does get glasses or contacts, what's important then?
Consistent wear is key,
Mm-hmm.
really important. And educators need to know too.
Why educators?
Well, does the suit need to sit closer to the front? Do they need breaks from close work? How might their vision affect certain activities? Teachers need that info.
Makes sense. And keep up with eye exams.
Absolutely. Annual reexaminations are vital. Vision can change.
And linking back to headaches, vision problems can be a cause.
Definitely. It reinforces that need to look for the root cause of issues. And for everyone, educators, parents, doctors, to communicate.
Yeah. And I guess the big takeaway here is that vision assessment should be part of the picture if a child is struggling academically or behaviorally for no obvious reason.
Exactly. And if 504 or special ed teams are involved, they should be looking at those vision records, talking to parents about any changes. Don't overlook the eyes.
Okay, let's shift gears. Hearing. Equally fundamental, I'd imagine.
Absolutely. Critical for classroom learning, for social development,
Mm.
all of it. And Dr. Knopf points out that, like vision, hearing issues can often fly under the radar without screening.
Right. And school screenings actually catch a lot that doctors might miss.
Yeah, it's quite striking. One study found school screenings identified nearly a quarter, 23% of kids with educationally significant hearing loss that hadn't been picked up by their primary care docs.
Wow. That really shows the value of those school programs.
It absolutely does. And just like vision, certain screening results mean, okay, time for a referral.
To an audiologist or a physician.
Yep. And the guidelines suggest getting that full evaluation done pretty quickly, like within a month or two, if the screening raises flags.
So what kind of flags are we talking about in a hearing screening?
Well, with pure tone audiometry, the beep tests things like not hearing the quietest sounds, like at 20 decibels,
Uh-huh.
or missing several specific pitches in one ear, or a significant difference between the ears, or just giving inconsistent answers.
Okay. What about other tests they might do? Tympanometry.
Right. That checks the middle ear. A flat curve, type B, often means fluid back there.
Which muffles sound.
Exactly. Also, significant negative pressure, type C, or if the eardrum seems too stiff, or if certain reflexes are absent, even if the tympanogram looks okay. All reasons for a closer look.
And are there observable signs during the screening itself?
Yes.
Huh.
Any obvious issues with the outer ear, if the child says their ear hurts or feels full, or if they mention ringing,
Tinnitus.
right? Or just if they seem to be straining to hear, getting fatigued, giving inconsistent responses.
And past history matters too, right?
Definitely. A history of lots of ear infections, ear surgery, no noise exposure.
Uh-huh.
Sudden changes in school performance or behavior, concerns from parents or teachers, or speech delays, all those things warrant digging deeper.
Got it. How common is hearing loss in kids?
Well, the CDC says about 15% of kids aged 6 to 19 have at least a mild loss, 16 decibels or more.
Dr. Knopf says even that mild loss can have a big impact.
Huge.
Yeah.
He emphasizes that even a mild loss can cause a student to miss up to half of classroom discussion.
Half, just from a mild loss.
Yeah, imagine trying to follow a conversation with the volume turned way down. You miss a lot.
Wow. And what does ASHA say about unidentified loss?
The findings are pretty sobering. Kids
Yeah.
missing 30% of speech sounds, scoring 10 to 15 percentile points lower on achievement tests,
Oof.
and being at higher risk for repeating a grade or getting behavioral referrals. It connects back, you see.
It really does. And even minimal loss, like under 20 dB.
Even that can cause trouble.
Mm.
Research links it to smaller vocabularies, problems with phonological awareness, understanding sounds and words, which impacts reading,
Right.
difficulty with multi-step directions, more fatigue from just the effort of listening,
That makes sense?
and potentially falling behind in language arts by a grade level or two by the time they hit 8th grade.
So these school screenings are really catching potentially serious issues.
They are. They're good at picking up different types.
Mm.
Conductive loss, often from ear infections, which can fluctuate.
Okay.
Sensorineural loss, which might get worse over time. Unilateral loss, just one ear, easy to miss otherwise. And even noise-induced loss.
And each of those types can have long-term effects if not addressed.
Yes, unfortunately. Conductive loss, if chronic, can lead to persistent infections, speech-language delays, sometimes balance issues, social isolation.
And it's sensorineural.
That involves damage to the inner ear or nerve.
Mm.
It can worsen, and research links it to faster cognitive decline later in life. Yeah, like 30–40% faster. And significantly higher rates of depression and anxiety, maybe 2 to 5 times the risk. Social withdrawal, too.
That's serious. What about unilateral loss, just one ear? Seems less severe, maybe.
You'd think so, but it causes real problems. Difficulty locating sounds, understanding speech in noisy places like a classroom or a cafeteria.
Big challenges for a kid.
Definitely. Linked to lower academic achievement, higher rates of grade repetition, needing special ed. Plus, it's just tiring, that extra listening effort.
Okay, and noise-induced. Is that becoming more common?
Sadly, yes. And it's permanent. Can cause not just hearing loss, but tinnitus, that ringing. Hyperacusis, which is oversensitivity to sound, faster age-related hearing loss down the road, sleep problems, listening fatigue.
The takeaway seems clear. Early identification and intervention are crucial.
Absolutely crucial. It can significantly lessen these long-term impacts.
And Dr. Knopf also mentioned an equity issue here.
Yes, a really important point. Kids from lower-income families are much less likely, maybe 30% less likely, to get hearing screenings during regular checkups.
So school programs are even more vital for them.
Exactly. They provide more equitable access to this essential screening.
Okay, now, for something maybe less obvious, what Dr. Knopf calls the hidden sense, respiratory and nasal issues, how do they fit in?
Right. It seems mundane, doesn't it? A cold, sinus infection, allergies. But these common things can significantly impact our main sensory systems, hearing and vision.
How so? The ear-nose-throat connection.
Exactly that. It's all linked. When you're congested, that eustachian tube connecting your middle ear to your throat can get blocked.
So fluid can't drain properly.
Right. And pressure doesn't equalize well. That creates a perfect breeding ground for bacteria.
Leading to middle ear infections, otitis media.
Which, as we mentioned, is the #1 cause of hearing loss in kids. Very common.
And even without a full infection, just being congested affects hearing.
Yes. Even mild congestion can cause a temporary hearing loss of, say, 25 to 40 decibels.
That's like plugging your ears, partly.
Pretty much.
Yeah.
And again, that could mean missing up to half the discussion in class. And if it happens repeatedly, you risk chronic fluid, maybe longer-term issues.
Okay, I see the hearing link. But vision. How does a stuffy nose affect vision?
It's less direct, but still impactful. Think about sinus pressure. It often occurs right around the eyes, causing pain, maybe affecting clarity.
Okay.
Allergies often come with allergic conjunctivitis, itchy, watery eyes.
Yeah.
Makes focusing uncomfortable.
Yeah, definitely.
Also, if breathing is really compromised, maybe oxygen levels dip slightly, contributing to eye fatigue. And severe congestion can even block tear ducts, causing blurry vision.
Wow, okay. So these seemingly minor illnesses can disrupt both hearing and vision.
They can. And that has a knock-on effect on learning.
Oh.
Well, if you feel lousy, you're tired, it's hard to pay attention. If you can't hear instructions clearly or see the board well, you're missing information. That can make kids hesitant to participate. It can mess with phonological awareness needed for reading. And the frustration can bubble up as behavioral issues.
Mistaken for something else.
Exactly. And the tricky part is, kids might not complain specifically about not hearing or seeing well when they're sick.
They just feel generally unwell.
Right. Or they don't realize their senses are off or don't know how to say it.
So teachers need to be observant. What should they look for?
Dr. Knopf lists things like a child asking for repeats a lot, moving closer to the board, maybe talking louder than usual,
Yeah.
a sudden dip in performance, seeming more frustrated or just disengaged. These could be clues that sensory issues are playing a part because of that cold or allergy.
Recognizing that link is key then, to provide support.
It really is. It helps minimize the learning disruption from what seems like just a normal childhood illness.
And ignoring it could potentially lead to bigger problems.
Well, Dr. Knopf cautions that while most things resolve, overlooking persistent issues isn't ideal, and in some rare cases we'll touch on, complications can arise.
Okay, that leads us to a perhaps more serious topic. Potential neurological implications. This isn't common, right?
Well, definitely not common. The vast majority of eye, ear, nose issues clear up fine. But Dr. Knopf explains that because these organs are so close to the brain, some infections or diseases can, rarely, have neurological consequences.
Oh, okay.
How could eye infections affect the brain?
Well, the optic nerve is a direct pathway. Conditions like optic neuritis inflammation of that nerve can cause vision loss and potentially damage nerve pathways back into the brain. Or orbital cellulitis, a serious infection in the eye socket. If that spreads, it can cause blood clots and sinuses near the brain, potentially leading to stroke or nerve damage.
Scary stuff, even if rare.
It is. He also mentions things like toxoplasmosis, a parasite that can affect the retina and sometimes spread to the brain, or complications from uveitis, chronic eye inflammation, which can sometimes be linked to neurological autoimmune issues.
Okay, what about ear infections spreading? Again, rare, but possible. Severe untreated middle ear infections could potentially erode bone and allow bacteria into the membranes around the brain, causing meningitis.
Which can have serious outcomes.
Very serious. Cognitive issues, hearing loss, seizures. Also, chronic ear infections can sometimes lead to brain abscesses, collections of pus, which increase pressure and damage brain tissue.
Wow.
And some inner ear infections, like labyrinthitis, affect the balance nerve, potentially causing permanent vestibular problems. There's also a condition called cholesteatoma.
What's that?
It's an abnormal skin growth in the middle ear. It can erode bone and potentially create a pathway for infection to reach the brain or affect facial nerves.
Okay, and nasal or sinus issues, can they reach the brain too?
Again, rarely, but yes. Severe sinus infections, especially in the sinuses close to the brain like the frontal or sphenoid, could spread and cause meningitis or brain abscesses. Also, the olfactory nerve, for smell, goes directly into the brain. Some viruses, potentially like SARS-CoV-2, might use this pathway.
Right, we heard about loss of smell with COVID.
Exactly. And then there are very rare but dangerous fungal infections, like mucormycosis, the black fungus, that can start in the sinuses and spread aggressively to the eyes and brain, especially in immunocompromised people.
That sounds terrifying.
It is. Even chronic inflammation from something like allergic fungal sinusitis could potentially erode bone over time and pressure nearby neural structures.
Why are children particularly vulnerable to these complications?
Several reasons Dr. Knopf points out. Their immune systems are still developing.
Right.
Anatomically, their eustachian tubes are shaped differently, making spread from the ear maybe a bit easier. Their blood-brain barrier isn't fully mature yet. Plus, they often can't clearly tell you their symptoms. And because their brains are developing so rapidly, an infection during a critical period could have more profound long-term effects if not treated promptly.
So vigilance is key from everyone involved.
Absolutely. Educators, related service pros, parents, being aware of warning signs, communicating with doctors for prompt evaluation and treatment. That's crucial to minimize the risk of any lasting neurological damage from these rare but serious possibilities.
Okay. So wrapping this all up, the big takeaway really seems to be this incredibly intricate connection, doesn't it?
It really is. Between vision, hearing, even breathing, and a child's whole ability to learn, connect, and just, well, thrive. It's deeper than we often realize.
Yeah. Seemingly small issues in one area can really send ripples through the whole system.
And understanding that, hopefully, empowers listeners, parents, teachers, anyone working with kids to be more informed, more proactive.
Right. Paying closer attention to these sensory basics, especially if there are unexplained struggles happening.
Might just lead you to identify an underlying issue much sooner. Catching things early makes such a difference.
So maybe a final thought to leave people with. How often do we maybe overlook these really fundamental systems, eyes, ears, nose, when we're trying to figure out why a child is having a hard time?
Good question.
And now knowing these connections, what subtle cues might we be a bit more attuned to? Maybe thinking about this will shift perspective or spark some new questions for people.